Is it true that chiropractic can help with bedwetting? Like for kids?
It has been measured in case studies before, yes. I cannot say whether it's definitely not true for all patients. I have had unsuccessful cases of enuresis, but I've had successful ones as well. Okay, Julia, I'm going to push a little bit deeper now into the muscles. Did you feel that spasm up there?
Mm. Yeah. Ooh, yeah.
Right or left?
A little bit more on the right. Not too much different.
Okay, let's check the motion here. Lean back into my fingers. Good. Come back. Pain there?
No, not that bad.
Okay, I'm going to test the SI joint.
Okay.
Just kind of come back like this. Pain there on my thumb?
Can you do it again? It's not bad.
You would feel it. It
Yeah.
would be obvious. Not too bad?
No, not too bad.
Okay, come this way now.
No, nothing. Ooh, right there.
Okay, open, close. Just the right leg. Just the right leg. Good, close. Right?
No, wait, the right.
Right, left. Okay, both. All right, so we've got movement on the left, but not as much movement on the right here. Now let's just see. Now the rib humping was on the left side here. And when I follow your spine down, you just have a little bit of a thoracic curvature. It feels like it's actually more rotated than it is curved. Mm-hmm. Did they take x-rays of it when you were a kid?
No, it was just kind of like a quick thing. Nothing was really done about it or said about it.
We got a march in place.
Wait, am I doing it right?
Yeah, that's perfect. Okay, there's more rotation on the right side here. The right ilium is moving, but the left side remains flat. Okay, stop. You're gonna feel my fingers on the back of your legs first, okay?
Okay.
I'm gonna trace this up to your glutes. So the right side is lower, saying it's potentially gone posterior and inferior. The left side is higher, meaning it rotated anterior superior. Looking from the top view, the right side is more rounded, which means it's gone EX. So PI, EX, ASIN, potentially. We have to recheck on the leg check, okay? All right, let's do Adam's sign. And then if this can be visualized, I'm not sure, but the left side is just a little bit higher than the right side. Okay, go ahead and stand up.
Oh, that's so exciting. And now what's going to suck is, whenever I crack myself, it's going to, you're going to ruin me from me doing it myself.
Good. Still tender.
Very.
T2 and 3. Let your shoulders relax. 6, 7. All right, let's do this now. I'm going to test your lumbar spine. So what I'm going to need you to do, keeping your knees straight.
Lift this leg in the air.
Good, down. Left. Down. Right. Down. Left. Down. Which side is easier?
I think left.
Any pain there?
Ooh, you cracked it.
Mm-hmm. That was massive too. Good, down. Left, down. The idea here is to just change the tone. Tender?
Very.
More than this side?
On the
Or?
right side is a lot worse.
Nice soft breaths in through your nose, out through your mouth. But let's practice one first, just so you can kind of feel it out, okay? Now I'm going to follow your breath down like this. Then loosey-goosey, just when we get to the end, we're just going to give a little push like that.
Okay.
Okay, nice and gentle. Breathing in through your nose, out through your mouth. Good. Let it all sink in. Let it all go.
Yeah, it was great.
And out. All right, so let your shoulders relax. Good. And breathe in through your nose, out through your mouth. Good. Let this come down. Good. Didn't quite get all of it. We're going to do one more. Okay, I'm going to move your head over to this side like this. Good, just like that. Let this all go. Your elbows in, and you're going to slouch down like this. You're going to breathe in, and then as you breathe out, we're going to lean back together, but hold the slouch, okay?
Okay.
Okay, take a deep breath in. Lean back, hold the slouch. Good, just like that. Good, keep breathing.
Ooh.
There.
I do this one all the time.
You do this one?
Yeah.
Okay.
To myself.
When you do it, do you get that big clunky one?
No, I've never felt that before.
Okay. That's cool. Just a little bit more. Now try to like relax. Loosey-goosey here. Good, let your shoulders relax. Good. Turn your head so you're facing straight that way. So for this one, what I'm going to do, Julia, is bring it down like this, and then push in that direction, okay?
Okay.
Okay, same thing. Deep breath in, and out. Good.
Oh my heavens. Whoo-hoo-hoo. That was something.
On your back.
I feel the burn.
Okay, turn your head to the right. Okay, that made it worse. Now turn your head to the left. Bring your right ear down to your right shoulder. Bring your left ear to your left shoulder. Tuck your chin to your chest. So we definitely have C2. Now turn your head to the right with your chin tucked. Tuck your chin. And now turn your head to the left. C2 on the right. Okay, push your head straight down into the table. How's that feel right there? Does that hurt?
Yeah.
That side?
No.
Good, Julia. Okay, you ready to get adjusted?
Mm-hmm.
All right, so what I'm going to do is I'm going to bring your head over to the side like this, and then we're going to push in that direction, okay?
Okay.
All right, so let's do the right side first. Okay, now feeling that you want to concentrate on here is just dropping, just letting it go. Let me do all the work. Good. Okay, take a deep breath in through your nose, now through your mouth. Okay, so let's test the left side here. Just let your shoulders and head just sink in. I'm going to test it right now. I'm not pushing yet. 7, 6.
All of that hurts.
Yeah,
by the
every
way.
single one of them almost.
Yeah.
We're going to have to find the most important one. All right, let the head relax here. That's good. Okay, nice soft breath in through your nose and out. Gosh.
I think I'm paralyzed.
Move your toes.
No. It's not nearly as intense as when I do it myself. Or, I mean, like, that was more intense.
There were 3 cracks in that last one.
Mm-hmm.
It was C4, C5, C6. C5 and C6 were the first 2 that cracked. And then it was C4, C5, which was the loudest one at the end. It was like...
Mm-hmm.
That last one, that C4, 5, that's that main segment that needs to move over here. It's better now. Okay, so this next one, Julia, I'm going to pick up your head like this. Go and close your eyes. You don't need to look at anything. And I'm going to lift your head like this. Good. And then I'm going to stretch it in this direction. Lift again, and then pull it like that, okay?
I already felt some give there.
All right, nice and gentle breathing in through your nose, out through your mouth.
I felt that.
How'd you get the scar?
I have no idea, actually. My father says he has no idea how I got it. But I've had it as long as I can remember. But actually I have scars all over my head. Which is kind of odd, I know.
Alien abduction?
I think I'm a robot.
Gonna open your jaw. All the way. Close. Open slowly. Close. All right, push your jaw to the right. Any pain there?
No.
Left. Ooh. That one feel weaker?
Yeah, for sure.
Okay, so I'm gonna bring your head over to here, and I'm gonna bring your jaw down like that. We're gonna give a little push like that, okay?
Okay.
All right, close your eyes. Ooh.
That was life-changing. Wow.
Okay, open. Close. Push to the left. Push your jaw to the left. Now, how's that feel?
Much better.
Okay, nice and loose here. Relax. All right, go ahead. You got any more cracks in there? Let's see. Go ahead. How do you do it?
I know this is weird, but I'll do this too.
That's awesome.
Ooh.
Okay, I'm gonna sit on your foot.
Okay.
Just kind of let this relax. Good. Okay, hold your knees together. Hold them together.
Oh, okay.
Okay, hold them together. Hard. Hold them hard.
That was like up through here.
Okay. Tender.
Mm-hmm.
Okay, breathe in through your nose. Good, and out. Breathe into your belly. Fill your belly up with air as you breathe in. Good. Out. Again, fill your belly up. Out. This is what you need to be cracking on yourself, your ileocecal valve. Same thing, find your belly button and your hip bone, right?
Okay.
Connect the line right into the middle, and then usually go straight down from there. Yours is a little bit more inferior or further down.
Okay.
Right, you find that spot and breathe into it. You'll feel it.
It's very tender.
It's
oh my
that
goodness.
right there. It's
Yeah.
stuck. Keep going.
You said that it cracks? You said something about that.
Yeah, it doesn't really. I just meant this is what you should be manipulating.
Okay.
Yeah. It doesn't really crack, but you'll get some gurgles from it.
Right. There was one.
Mm-hmm. You'll feel it release, either with or without a gurgle, but you can like feel the tenderness dissipate. Not so bad, right? Does that feel better?
Yeah, it does.
Squeeze. Hard. Good, relax. Squeeze. What's the snake mean?
It represents loss of innocence.
Okay, let this relax. See if we can do it to that one. Damn, dude.
Are you impressed?
I am, dude. That's deep.
They say that it has to do with writer's block or something like that. But like some people say like if you're having like writer's block or like, and I don't know, some type of like emotional thing.
Mm-hmm.
That
Your head's good.
Oh.
Okay. Go.
It will stay like stuck, or it's good to crack it. I don't know.
Mm-hmm.
Sorry.
Did you just get tingles?
Yeah.
Okay, look straight ahead. Let me see your tongue. Clean it off and then let me see it again.
Clean it off.
Yeah, like just like you take all the saliva off of it. Okay. There's some candida going on your tongue. And it would help significantly in all aspects of your life if you did a sugar cleanse. 14 days, no sugar. You can do it. 2 weeks.
I love sugar.
Yeah. Mm-hmm. So does candida. Fungus that lives inside the gut. And so when you eat the sugar.
Is that why sometimes I have bad breath, you think?
Yeah.
Yeah.
Uh-huh.
That's why I chew gum all the time.
It's not coming from your mouth. All right, let's see. Go ahead and stand up. Take that for a test drive.
I feel so